good morning, good afternoon, or indeed good evening, depending on where you are joining us from. You're very welcome along to this co-hosted fantastic policy conference show that we have lined up for you. Now, EASO and ECPO are sponsoring this and running this along with our partners who we're very grateful for to make this happen. Now, before I actually jump to any of our opening speakers that are lined up, I want to kind of run through some of the technical platform to make this truly interactive so you can join in and share your comments, your thoughts, and of course your remarks. You'll notice on the platform to the right of me, there is Slido, so therefore you don't need to leave us. You can stay right here and you can answer the questions. I can see already you're populating it, people across the globe, which is just fantastic to see. You will also notice there is a Q&A feature. You can answer questions in there. You can ask questions to our panelists or our co-chairs. You can also vote on other people's questions or comments and see who is more popular in the comments, the Q&A. We are following this as well on social media. You'll notice that hashtag Obesity Day Europe and hashtag Obesity Policy will be used. Now, below me, there is a maximize and a minimize button. Beware that if you maximize us, you will not be able to see the features such as Slido and the Q&A. So if you minimize that, you can follow the kind of conversation that's happening in there. You will also notice there is an agenda. It is on the program tab up above where you can see our speakers and the content of the sessions. Now, I do have three fantastic co-chairs who will be taking us through these sessions. But before that, I would like to hand the floor to the one and only fantastic EASO President, Ms. Nathalie Farpour-Lambert. Nathalie.
Hello, it's really a great pleasure to be with you, and I would like to welcome the Obesity Policy Conference, a conference which is co-hosted out of with the European Coalition for People with Obesity. It has been a very hard year due to COVID for people living with obesity, and it also has been a challenging year for the scientific and the clinical community. But this year has also brought out the need to acknowledge gaps in how we address obesity along the life course. Today's conference allows us to start working towards solutions which can be driven through policy change together. On behalf of the European Association for the Study of Obesity, now with member association in 36 countries across the European region and over 136 collaborating center for obesity management, I'm delighted to welcome EU policymakers from the European Parliament and Commission, from the world of research, regional and national government agencies. EASO is proud to play a role through our work with and on behalf of the scientific community, policymakers and people with obesity. We really look forward to a fruitful and dynamic discussion today. So now it's an honor to introduce Mrs. Pernille Weiss, of the European Parliament. She's representing Denmark at the European Parliament. She has been able to bring her background as a registered nurse, science and innovation leader in the Nordics to make a positive change for European citizens, which can take a holistic and systemic approach. Industry, Research and Energy Committee and is substitute of the Committee on the Environment, Public Health and Food Safety. Mrs. Weiss also holds a substitute seat in the Women's Rights and Gender Equality Committee. EASO is proud to coordinate the new MEP interest group on obesity and resilient health systems, for which Mrs. Weiss is the chair. So welcome, Mrs. Weiss.
Thank you so much for this nice welcome, and thank you for this opportunity to work together with all of you, because as you said, I am a nurse, but I'm also a politician, and COVID have made policy all over the world aware that we need to be more pragmatic and science-based about solving our major health challenges. The Foresight report and related processes highlights the need to build resilience across all portfolios. That serves as a key message to the work ahead of us. Obesity has been highlighted along with the cancer as the two NCD keys, which needs to be properly addressed as a major element of the puzzle to build resilience in Europe. But what does this mean concretely? What do you as stakeholders need from us politicians and policymakers? The role of MEPs in resilient health systems can be to provide a bridge across EU institutions and national systems to create a kind of system that works for all. I hope today to get input from you and also ideas of how to actually design and make this bridge work, both to raise awareness to a very important role that obesity plays in the European resilience, but hopefully also to nurture and catalyst the many opportunities for innovation and SMEs that can that can be brought alive as a potential global success story. Today I will listen, and I hope to see how to contribute collaboratively during discussions and how to think them back to the Parliament, and particularly as the newly formed MEP interest group on obesity and resilient health systems. I'm right now collecting support from my fellow groups in the European Parliament, and amongst one of them you find Sarah Sjödén from S&D in Portugal. She is very, very active as also a member in the Special Committee on Beating Cancer, and she will speak soon in this session here in session number 1. Both Sarah and I, we very much look forward to listen to you today, and also in the frame and respect of when we look at the EPRS in-depth analysis report on obesity and resilience health systems, we see that a fresh look on addressing the long-term impacts on society and our ability to reach our EU ambitions of competitiveness is long overdue. So let's get started, and thank you for being with us today. Thank you so much.
Thank you very much, Mrs. Weiss. It's now a pleasure to introduce Mrs. Anna Lönnroth. EASO is proud to be a very active stakeholder towards the European Commission across all services. In particular, we had been delighted to welcome Commissioner Maria Gabriel today, but unfortunately, she has been called away unavoidably. In her place, we give a very warm welcome to Anna Lönnroth, who has been head of unit to the Healthy Lives unit of DG Research and Innovation since 2019. Dr. Lönnroth's unit within the People Directorate focus on primary, secondary and tertiary prevention, as well as the impact of external environment factors. So warm welcome to Mrs. Anna Lönnroth.
Thank you very much for that kind introduction, Nathalie. And indeed, I am speaking on behalf of Commissioner Gabriel, who regrets very much that she couldn't attend today, but she has asked me to extend her warmest, let's say, good luck to all of us for this conference today. So really on behalf of the European Commission, it's really my great pleasure to be part of the opening of this important event. And maybe I will state the obvious to you now, but I think it's important to set the framework and the background. So we all know that through their increasing prevalence and associated complications at all ages, obesity and pre-obesity represent one of the biggest and persistent health concerns of today. Not only is obesity a self-standing disease that decreases the quality of life, but it also is the root for many other severe diseases, such as cardiovascular disease, type 2 diabetes and cancer. The research demonstrates that by treating obesity, we can prevent 80% of type 2 diabetes and up to 20% of adult preventable cancers. So by addressing obesity, it will be really important to contribute to Europe's Beating Cancer plan that has just been launched as well. So this shows us these things are really interconnected. Another aspect that's already been mentioned this morning, it can be a severe risk factor for certain other diseases, such as we've seen sadly in this COVID-19 pandemic. But obesity is also costly. Almost 7% of the national budgets across the EU is spent on diseases associated with obesity every year. So what if we could prevent the preventable? Or what if we could treat the treatable? What if we could increase the well-being of people living with obesity and facilitate their daily life? So research and innovation can deliver just that. And this is why the European Union has invested significantly over the years into research and innovation. The Union supports projects that can make the difference for citizens, as well as provide the evidence needed for policy making, such as in health promotion and disease prevention. So the Horizon 2020 actually has invested more than 200 million euros in specific projects from basic and clinical research to translational and implementation research. Very valuable research in this area is already ongoing as we're speaking. We should not forget that. So to prevent the preventable, health promotion and disease prevention must become the drivers of how we think about our health. The Farm to Fork strategy seeks to facilitate the shift to healthier diets and reinforce European public health by reversing the rise in pre-obesity and obesity rates across the EU. But we also need to better understand all the causes leading to obesity, to address it at best and devise personalized interventions. So for example, exposure to certain chemicals throughout life also represent a susceptibility risk for obesity and hinder effective treatment. How such exposures influence metabolic diseases, including obesity, features prominently in our two flagship research clusters on endocrine disruptors and on the human exposome. So as I mentioned earlier, in the light of the COVID pandemic, investing in research on obesity is even more urgent. Indeed, it has emerged that patients with obesity showed particular fragility, having more complications and an increased death risk. The pandemic has also pointed out an entirely different aspect, namely health systems' capacity to manage patients with chronic diseases, including obesity. This stresses again how important it is to design future health systems to be more responsive, resilient, and sustainable for all. So this is why Horizon Europe comes in, and we're aiming here at the holistic approach to promote health and tackle diseases, to grow the body of evidence on which sound and effective public health policies can be built. So Horizon Europe has been co-created across the Commission services, but also in close dialogue with the citizen in order to ensure that it will deliver tangible and effective outcomes. So this holistic philosophy is exactly what is needed in order to be able to develop impactful measures to prevent and treat obesity. So the Commission firmly believes in the health in all policies approach. So for achieving this goal, all stakeholders, including researchers, clinicians, citizens, policymakers, decision makers, need to work together in a much more cross-sectorial way. This is what we pursue through Horizon Europe. So what needs to be done here today is to better understand where we stand, identify the gaps and opportunities that we have in front of us in order to spell out what needs to be done next and when, and then search in our Horizon Europe toolbox for the most efficient instrument to address this. So I hope really that today's event will bring many good ideas for actionable solutions to the table. So let's make this World Obesity Day Europe today an important stepping stone into the future. So again, on behalf of the European Commission, thank you very much, and I very much look forward to this event. Thank you.
What a wonderful opening statement. Thank you so much to, of course, our President of EASO, Nathalie Farpour-Lambert, our MEP, Pernille Weiss, and of course, Ms. Anna Lönnroth, apologies, for those wonderful words. Now, as you can see on the Slido, we have many people who are joining in from across the globe. I'm grateful that I don't have to pronounce everybody's name. I will leave that to my co-chairs, because we have people joining in across from Lebanon, Malaysia, Spain, Turkey, Vienna. We have people from Poland, Geneva, of course, Kuwait, Netherlands, Luxembourg, Brussels, of course, with our European Commission, Kenya, Pittsburgh in the US of A, Istanbul, and many more places. So I'd invite you to continue to answer the Slido questions so we can really make this as interactive as possible.